Hi everyone, today I'm going to tell you a little bit about medical technology both as a major at SUNY Fredonia and as a career. So in case you don't know me, my name is Gabby. I graduated from Bolivar Richburg in 2018 and I am currently a sophomore medical technology major at SUNY Fredonia. So as a career, medical technologists perform many different tests on a variety of samples to aid doctors in diagnosis, treatment, monitoring, and prevention of diseases. The setting for medical technologists can vary, but it includes hospital laboratories, private laboratories, physicians' offices, forensic laboratories even, and much more. And medical technologists use a variety of different sciences to do their job, including chemistry, hematology, immunology, microbiology, and molecular biology, all of which you would study at Fredonia. So as a career, here's just some facts about medical technology. It has an average starting salary of $52,000. It ranks number 3 among health-related professions, and this is including surgeons and doctors and physicians. So it ranks number 3 overall in all health-related professions. Employment is predicted to increase at 22%, which is much faster than average. It has 25% projected job growth. And a lot of these facts is due to the fact that there is a shortage of trained employees in this field, which guarantees job security and high salaries right off the bat as a medical technologist. So at Fredonia specifically, you take 3 years of classes, and then your 4th year you do a 1-year clinical internship. And this you can do in Jamestown, New York, Erie, Pennsylvania, or Rochester, New York at the cooperating hospitals. So that 4th year you get experience in classes in a real-life laboratory setting under practicing medical technologists. So Fredonia is really special. Specifically, we have this science center that was just built in 2014, and there's a lot of laboratories in there, a lot of state-of-the-art equipment, and everything that you need to be a successful medical technologist. So here I've included the medical technology curriculum. So this is what I am currently going through and what you would also go through if you were to study medical technology at SUNY Fredonia. So as you can see, your first year you start off with your gen eds, obviously, that everyone has to take to give you a good basis in knowledge. And you would take your intro classes in the sciences, general chemistry, and then in your 2nd and 3rd year, you start to get more specific in courses that will really help you as a medical technologist specifically, including immunology, serology, parasitology, hematology, physics, and all of these classes are really getting you ready for that 4th year clinical internship where you will take classes and get that experience that will really get you ready to be a medical technologist. So at Fredonia State, so after you complete this internship, you pass your board exams, you graduate. You get a bachelor's degree of science from Fredonia, you get clinical certification from the hospital, national board certification, and you get official licensure from the New York State Education Department. And basically what all of this means is that you are ready to go and be a practicing medical technologist in the real world. So Fredonia is special in many ways. I mentioned the new Science Center with state-of-the-art facilities, and they really are great, especially compared to many other state schools. We have the NACLS accreditation. We are the only SUNY to offer official licensure at this time, so the only SUNY that you can graduate from in this program and be ready to go be a practicing medical technologist. And as I mentioned, you get that unique hands-on experience for the entire 4th year at Fredonia, where you get to go and do that clinical internship at a real hospital. So here's just some facts about Fredonia graduates specifically. So over the last 10 years, 97% of Fredonia medical technology students have passed the board exam on the first try. That is compared to the national pass rate of only 76%. So that fact alone tells you how well Fredonia prepares its students. So you know that when you graduate, you are ready to go be successful. And many graduates have gotten several job offers as early as 3 months before they graduate. And a lot of these job offers also include signing bonuses up to $10,000. And this also just lets you know how well Fredonia prepares its students because we are well wanted after you graduate from Fredonia. And recent graduates have been hired in hospital laboratories, biomedical research facilities, forensic laboratories, and more. So now I'm going to go on to give you a little case study. So this is just an example of the types of things that you would do as a medical technologist. So we're going to look at one patient specifically. His name is Mr. Garner, and he has a serious case of pneumonia, so he visits his doctor. His symptoms include a fever of 102.7 degrees Fahrenheit, chills, shortness of breath, and a cough that results in a lot of mucus that is sometimes tinged with blood. The doctor suspects that he has a bacterial infection in his lungs, so he orders laboratory testing to be done on his patient. We medical technologists over at the lab receive a sample of his blood and a sample of his mucus. So the first thing that we're going to do is a complete blood count, also known as a CBC, and this is something that is done extremely often as a medical technologist because the amount of blood cells compared to the normal amounts gives us a lot of information on what's going on inside of a patient's body. So here on the left side, you can see the normal values for each thing that the complete blood count tells us. And over on the right side here, you can see Mr. Garner's values. Everything seems to be in order except for the fact that over here, the normal white blood cell count caps off at 10,000 cells, and Mr. Garner's white blood cell count is at 32,000 cells. So it is extremely elevated. One cause of extreme white blood cells like this could be leukemia, but since we know what his symptoms are, the white blood cells being so elevated is definitely indicating that he has an infection. So he could have a viral infection or he could have a bacterial infection. So over here on the left shows you what a normal blood smear looks like. This is going to tell us about the different kinds of white blood cells inside of Mr. Garner's sample. We're going to look today specifically at two types, lymphocytes and neutrophils. The lymphocyte here, you can see that the nucleus is very round and it takes up almost the entire cell. And you can see here the neutrophil has a very segmented nucleus. And this difference in shape in the nucleus is how we can tell the difference between these two types of white blood cells. So if we see an increased number of lymphocytes in his sample, that indicates that he could have a viral infection. And if we see an increased number of neutrophils, that's going to tell us that he has a bacterial infection. So over here, we can see Mr. Garner's blood smear, and we can see that there is a bunch of these cells with that segmented nucleus. So these are all neutrophils, and since there's so many, we can indicate that he has a bacterial infection. So we're going to move on and we're going to use microbiology to determine what kind of bacterial infection is present in Mr. Garner. We're going to do something called a gram stain, and this will tell us about the construction of the cell wall of the bacteria. So from this, we can distinguish between two common bacterial lung infections, Streptococcus pneumoniae and Klebsiella pneumoniae. So this is the basic procedure for a gram stain. On the left here, you can see what happens if the bacteria is gram positive, and on the right, you can see what happens if it is gram negative. So you do an initial stain using crystal violet stain, an iodine treatment, and then you wash the stain away using something like alcohol, and you can see on the gram positive side, it doesn't get washed away, it sticks to that cell wall. And on the right side, you can see that it does get washed away, also based on the composition of that cell wall. So then when you stain it one last time, the gram positive is going to be much darker, a really dark purple color, and the gram negative is going to appear as a light pink color because it only has that one stain present. Okay. So here are two examples. On the left here, we have the Streptococcus pneumoniae, which is gram positive. So you can see that it is dark purple circles. And then on the right here, we can see Klebsiella pneumoniae is gram negative, so it appears as small pink rods. So up here I have the examples again compared to Mr. Garner's. So his gram stain, we're going to say, does it have these small pink rods or does it have these dark purple circles? we can see, based on comparing Mr. Garner's gram stain to the examples, that he also has small pink rods, indicating that it is gram-negative, and most likely Klebsiella pneumoniae is the bacteria that is infecting his lungs. Next, we're going to do something called a McConkey agar, which is an example of macroscopic analysis. So this specific type of agar only allows gram-negative bacteria to grow. So since we know that Klebsiella pneumonia is gram-negative, we are going to expect that the McConkey agar will allow successful colonies to grow on it. This also gives us information on whether or not the bacteria growing ferments sugar. So we know that Klebsiella pneumoniae is a gram-negative bacterium that ferments sugar. So on this agar, we're going to expect it to grow, first of all, and we're going to expect these colonies to turn pink because it ferments sugar. If the bacterium that grows does not ferment sugar, it tells us that it is in fact gram-negative, but it does not ferment sugar, so it'll be tan, no color. So here on the left side, you can see a gram-negative colonies, because colonies grew, but it's pink, so this means that it does ferment sugar. And on the right here is also gram-negative because there are colonies, but it's tan, so that means that it does not ferment sugar. So for Mr. Garner's, we're looking for something more like the left side because we are suspecting that Klebsiella pneumoniae is what is infecting him. So here is Mr. Garner specifically. You can see that there are successful colonies on his McConkey agar plate, and you can also observe that they are pink. So this tells us that we are correct in our assumption that Klebsiella pneumoniae is the bacteria that is infecting Mr. Garner. So from beginning to end, starting with the complete blood count and ending with the McConkey agar, our evidence all points to Klebsiella pneumoniae being the bacteria that is infecting Mr. Garner. So now that we've narrowed it down to that, we'll do a few more tests to see which antibiotic we should use to treat Mr. Garner specifically, but the most common form of antibiotics are cephalosporins, aminoglycosides, and fluoroquinolones. So if you have any questions about any of this, please feel free to email me, whether it be about Fredonia, the medical technology program specifically, or about medical technology as a career in general. I'd be happy to discuss things further with you. Thank you for listening.